You are hilarious. I can honestly say that.
I wanted you to share.
I'm Dr. Joffrey Mount Varner. I'm an ER doctor, board certified ER doctor, as well as a crisis and split second decisions expert. What that means is I go around the world, teach executives and teams how to manage crisis and more importantly, how to make decisions, especially split second decisions. I'm also an avid runner, so I still do marathons, triathlons, and run. And that's it.
Wow.
Father of 18-year-old and a 15-year-old.
That's what's up. Welcome to Body by Malaika, the continuing story of a health and wellness journey. I'm Malaika J. Cox, certified personal trainer and nutritional specialist for over a decade. Episode 5. The purpose of the Body by Malaika show is to help others who might struggle with weight loss, mental challenges, insecurities, and or nutrition by working on wellness. And what does wellness mean, right? We're going to talk about that. But my unique approach to fitness is tapping into the mind. Our mind is one of the most powerful tools of the human body. I mean, we can conquer anything once we tap in and connect. In today's episode, we will talk about fitness as an alternative to medicine. I've talked to some doctors as well as some health professionals to just find out and dig a little bit deeper about that topic. According to the Harvard Health Publishing Company, physical activity is often as effective as drugs when it comes to preventing death, diabetes, and cardiovascular diseases. Surprised? I sure was. And so that's what intrigued me to do this episode. You know, wellness is the act of practicing healthy habits on a daily basis to attain a better overall physical, mental health outcome. So that instead of just striving, you're thriving. Thriving is beautiful. It's a feeling that is what some people might strive towards in life. Personally, I know I was striving to have an overall balance, and today I'm working on that. If someone or something thrives, they do well, and they are successful, healthy, and strong. But hey, how do we stay well and are successful and healthy and strong, right? I mean, thriving and wellness can go hand in hand with staying fit and healthy. And we talked a little bit about thriving and wellness, you know, above, which brings me to the topic that I mentioned earlier, which is fitness medicine or a form of medicine? And today we're privileged to talk to some physicians who had some feedback. We can roll. Thank you. So, yeah, we don't have to actually, the reason, like I was sharing earlier, and thank you for allowing me to ask you a few questions, because the topic of you know, I don't know, is I was learning, and it seems like fitness can be a form of medicine. When you say medicine, though, that could be tricky, obviously, but I'm saying to utilize it for people who have some diabetes, for example, you know, or maybe some chronic illness possibly. Would that be helping them, depending on the person, as a form of medication that they could use instead of not necessarily all the quote unquote medicines that you all might prescribe?
Right. That's a great comment. And I like the path that you're walking down. But let's wrap it around what's going on in the world. And we're in this COVID space. And so a lot has come out about health. What we do know is that the healthier you are, the more robust your immune system is, the more it's ready to function optimally. The American Heart Association says that people should exercise at a minimum 55 minutes a week. I would probably say that's probably not enough, especially when you wrap that during a crisis. So when we are chronically stressed, like during a crisis, when we're chronically stressed, what happens is our body secretes this hormone called cortisol. It's known for being a stress hormone. But chronically elevated levels of cortisol causes transient temporary decreases in your immune system. And any decrease in your immune system is an opportunity for an infection, including the COVID infection. But even outside of COVID, it's an opportunity. Any transient decrease is an opportunity for infection to enter your body. And to come full circle, if you're constantly exercising, it decreases your stress levels. So if you have a regular exercise regimen, then you are decreasing your stress levels. Additionally, studies have been very, very clear. People with regular physical activity have increased white blood cell counts. Those white blood cell counts, that's what helps us fight off infections. And then studies show that they are more prepared to fight any type of medical ailment, not just infections, just even cancers. Have you noticed that there have been many articles that cancer patients who maintain and the active word maintain an exercise regimen tended to do better. And part of it was probably the physical activity, but also the mental health, that the improved mental health that comes from working out.
So the mental health is a kind of a strong factor.
I would say that the mental health is probably more important than the exercise, but I would also say that you don't, and this is opinion versus fact. I would also say it's difficult to have maximum mental health without some kind of exercise regimen.
So they kind of go hand in hand. That's from my experience.
Kind of, but I know people with great mental health and they don't exercise.
Right. No, I was saying that for overall health, as far as it being like a form of a medication or medicine, the word medicine, you can maybe no, okay. I mean 30 minutes or what you have mentioned about being working out, as far as to help as a form of I guess medicine, not medication per se that is like prescribed.
I wouldn't even say medicine.
Okay.
I see what you're saying. It's as a form of a form of maintenance of health.
Okay.
I wouldn't call it medicine. And there are a lot of studies that support that. For instance, if you have a regular workout habit, you're less likely to be a diabetic. You are less likely to have coronary artery disease. You're less likely to have a stroke because you are in better shape. But what I call it medicine. I would call exercise a therapeutic intervention if you want to stretch.
Ooh, therapeutic intervention. And when we talked about you remember how you just mentioned about mental health? So therapeutic, and maybe you could clarify it to me. I hear therapeutic, and I mean it's like rejuvenating, like my overall well-being of my body being transformed into a healthier lifestyle.
When you say transform, what do you mean?
So like I'll talk candidly. That's going to be in one of my other episodes. So I had irritable bowel syndrome, IBS, and now it is on I want to say chilling. It's like right here. If I eat anything, now I know what affects me, and so I had to transform, my way of my body, how I was living, I guess I'm trying to say before. So from a therapeutic standpoint, I cannot eat certain foods because it will aggravate, my body. And that's what I meant by
So from
therapy.
a therapeutic mean like healing, assisting in the healing. Yes.
Okay.
That would make sense.
Definitely the irritable bowel helped by me watching. Believe it or not, actually, I don't eat any more animal products. I don't know if that was a major contributor, but I know that coffee, certain coffee elements and stressors, and also when I'm an ex bodybuilder, okay. So when I used to compete, I did not measure my food or anything in the very beginning. So I felt that it aggravated me by eating the animal. I don't think the animal per se aggravated it, but it was me, my little body trying to eat all that stuff.
Right.
And I appreciate it. But that was that on me and my IBS.
And it is controlled now.
It is for about
Congratulations.
12 years.
Congratulations to you. Good for you.
That's crazy though. Too, with products, and you talked about vitamins, I'm so unfamiliar with it because like I just switched to plant-based about less than a year ago. So
You came across as that plant-based type. Let me guess, you don't do modern medicine anymore either. Is that correct?
Yes, I do.
Oh, good. Okay. That's good.
I'm doing that, and I'll keep it candid because my stomach loves me for it.
Okay. All right.
Yeah.
You had some questions about vitamin D.
Yes. I was just curious of how important it is, and lacking as far as some of the people that may not actually get that. How important?
Let me give you a very broad overview. Vitamin D, and the reason why it probably doesn't get as much attention as it should, it's really a hormone. Although they classify it as a vitamin, it is a hormone. It helps greatly in many aspects of our system, especially our immune system, as well as our mental health, as well as our musculoskeletal health. I mean, our joints, our muscles. In addition, what we find is that in this country, the U.S., about 64% of Americans are vitamin D deficient, but 82% of Black Americans are vitamin D deficient, and over 60% of older people are vitamin D deficient. Here's why. Most of our vitamin D comes from being exposed to the sun. In fact, 90% of it comes from being exposed to the sun. However, the darker you are, the less efficient you are at converting sunlight to vitamin D on your skin. Hence, that's why you find many Black Americans and people of color who are vitamin D deficient. Let's talk about the older population.
Yes.
Regardless of color, because of the skin changes that go on with aging, the less efficient you are at converting sunlight to vitamin D. So therefore, you're very likely to be vitamin D deficient. And even for those people like me who work out in the sun, the studies are recently showing that simply putting on heavy amounts of sunscreen, it inhibits the sunlight from being able to form vitamin D on your skin. So you're more likely to be vitamin D deficient as well. And vitamin D plays a humongous role in our immune system. For instance, all of our cells have vitamin D receptors. So consider vitamin D the regular. It helps slow things down, speed them up. It's almost like the ref. You know, it stops the fight, slows it down, moves it forward. If vitamin D is absent, then you can get an overreaction, hence, which is what you see in COVID. You see an overreaction of our immune system. And keep in mind that the majority of those people who died from COVID, many of them were people of color and older people. And one study showed that in this French study, it showed that 85% of those people who died from COVID were shown to be vitamin D deficient. Hence, vitamin D plays a humongous role. Then the question becomes, well, how do I go about getting vitamin D? well, obviously talk to your primary care doctor. But there are certain foods that are rich in vitamin D. I'm sure that you
Yes.
know vitamin D, dairy products, salmon, if you more tuna, there cheeses. There are a lot of foods that are rich in vitamin D. Then you start talking about supplementation. Well, keep in mind, 90% of it comes from the sun. So if anything, getting out and being exposed to the sun. But taking over-the-counter supplementation is something you should talk to your doctor about. I know that Dr. Fauci, he did announce that he takes about 6,000 units a day. I take about 10,000 units a day.
Mm-hmm.
But if you look at three different national bodies, they give you three different amounts in terms of how much you should take. By and large, it's anywhere between 3 to 5,000 international units of vitamin D that you should take daily. And by the way, it's very difficult to get vitamin D toxic, but some of the signs of being vitamin D toxic are nausea, vomiting, feeling very, 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 very tired. 99% of the time, the treatment for it is just simply stop taking the vitamin D.
So the form of medicine as being fitness, meaning fitness, when I say fitness, I'm saying exercise, nutrition, the overall balance is a form of medicine to heal the body.
I would say that exercise has medicinal value.
Okay. Along with medication?
It just depends on what's going on.
Okay.
I just think that exercise to me helps almost every aspect of medicine. If you're able to exercise, especially if you're able to do cardiovascular exercise.
So that is a key element.
Yes. Well, it depends. I've actually learned this on Clubhouse. So, for instance, if you're a woman of a certain age, resistance work may actually be more important than cardiovascular exercise.
Really?
Yeah, I'm outside of my area of expertise.
Okay.
But by and large, cardiovascular exercise is to the top for me, and then everything else thereafter. If you're a man who's over 40, then resistance helps as well because it helps maintain your testosterone levels.
Okay. And like for instance, my mother, who's a little bit older, so because she has weak body, exercise as far as her working her core strength and walking could help with her overall, I guess, balance too. And vitamin D she's lacking. So you talked about that, but
yeah, core strength is very important as well.
Okay. So that was it. I got what I got my questions. And did you want to say anything else at all about the topic of you mentioned vitamin D, and then we talked a little bit about.
So sure, I think that if you want to have an immune complex or an immune kit of vitamins, well, I'm not a vitamin expert. I'm not a prevention doctor. Not a new nutritionist, but if you're going to take a kit of vitamins, I would say vitamin D, vitamin C, vitamin B, zinc, and melatonin. I would call that my immune kit. Because those vitamins help with your immune system.
These are questions that I've asked a few people in the health industry. I will definitely do another episode about the variety of answers, but I did have a few today, and I will share that. So let's find out what you think about this. To leave a comment, go to my listing in the app. Tap on the comments tab and then tap on add a comment in the comment box. Or you can DM me on Instagram under Molly Freebird if you are open to it.